Hello my geniuses, welcome to another anatomy lecture series on the ureter. It's your great science teacher Lorenzo, and if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you're sure to be notified. If you need me to make any topic for you, or you have been having issues studying any topic, put it down in the comment section when I go to it and make the video for you. So let us jump right into the video. We'll be discussing the ureter in this following outline. We'll introduce what the ureter is, we'll talk about the cause of the ureter, we'll talk about the part and the relation of the ureter, we talk about the constriction in the ureter, we'll talk about the blood supply, nerve supply, lymphatic drainage, and a clinical, one or two clinical correlation. So let us jump right into the introduction. So the first question we'll be asking ourselves, what is the ureter? Very simple. What is the ureter? A ureter is a what? A narrow, thick, extensible, and a fibromuscular tube which transports urine through a peristatic wave of contraction from the kidney through the renal pelvic to the what? Posterior superior angle of the what? Bladder. It's about 10 inches, which is 25 centimeter long, and the diameter is about 3 millimeter. So what you should know that it transports urine through a peristatic wave of contraction of the smooth muscle from the what? Kidney to the what? Bladder. What journey does the ureter take to reach the bladder from the kidney? So it's very simple. Know it through the landmark. First of all, the ureter continues as a continuation of the renal pelvis of the kidney first, the continuation of the renal pelvic first, then it descends downward and medially, where it passes in front of the psoas major. So 1 from the renal pelvic, 2 medially in front of the psoas major, that separates it from the transverse process of the lumbar vertebrae. 2, 3, it descends downward, enter into the pelvic brain. That is the third one. It enters into the pelvic brain. In the pelvic brain, it causes the what? Bifurcations of the common iliac artery in the pelvic brain, which is in front of the sacroiliac joint. Then now, do you know what it does? It continues laterally. Now it goes laterally, where it passes the anterior margin of the greater sciatic foramen, in front of where? The ischium spine. So don't forget the ischium spine. Then what happens? It now goes medially now, where it enters into the base of the what? The base of the what? The bladder, at the what? Posterior superior angle of the bladder. It enters there to the what? Ureteric what? Orifice. Don't forget it. Forget the landmark I just discussed. The first one is a continuation of the what? The renal pelvis. Second, in front of the psoas major muscle, separated from the what? The transverse process of the lumbar vertebrae. Third, it enters the pelvic brain, where it causes the what? Bifurcation of the common iliac vessel in front of the sacroiliac joint. The next one, it goes laterally, where it causes the anterior margin of the what? The anterior margin of the what? The sciatic foramen in front of the ischium spine. Lastly, it goes medially, where it enters the base of the what? The bladder at the posterior superior angle. Don't forget. What is the part of the ureter? The ureter has two parts. Don't forget, the ureter has two parts. The first part is the what? The abdominal part, which is what? 12.5 centimeter, and the what? The pelvic part, which is also 12.5 centimeter, making 25 centimeter. The abdominal part start from the what? The renal pelvis, as a continuation of the renal pelvis, and end at the pelvic brim, where it causes the bifurcation of the common iliac vessel, while the pelvic part start from the pelvic brim at the bifurcation of the what? The common iliac vessel, and end in the base of the what? Bladder. What is the relation of the ureter? The ureter is related anteriorly and posteriorly for the right and left ureter. It's related anterior and posteriorly for the right and left ureter. The posterior relation for the right and left ureter is the same thing. Why? Because in the abdomen, they cross in front of the psoas major in the abdomen, while in the pelvic, they cross in front of the bifurcation of the what? The common iliac vessel. So don't forget that they have two posterior relation, which is the what? In front of the psoas major and the bifurcation of the common iliac vessel. But the anterior relation is different for the right and left ureter. For the right ureter, don't forget the mnemonic SIR. SIR raised to power 3. SIR raised to power 3. So SIR with a triple R. Now what is S? Second part of the duodenum. I, ileocolic vessel. The first R, the root of the mesentery. The second R, right testicular ovarian vessel. The third R, right colic vessel. Don't forget. SIRRR. S for second part of the duodenum. I for ileocolic vessel. The first R for the root of the mesentery. The second R is for the what? Right testicular ovarian vessel. The last R is for the right colic vessel. For the left now, don't forget LLSS. LLSS, that is for the anterior relation of the left ureter. L is for the left testicular ovarian vessel. The next L is for the left colic vessel. S sigmoid vessel, the last S, sigmoid mesocolon. So don't forget SRRR, and for the left part is what? LLSS. Don't forget. Why is the ureter constricted? The ureter is not uniform throughout. It is constricted in some parts to trap what? Foreign particle or what? Kidney stones, or any particle that is passing through the ureter to allow them to reach the bladder or go to another part in the body. So they are constricted in three basic parts. The first part is the what? The pelvic-ureteric junction. The pelvic-ureteric junction, which is 5 cm from the what? The renal pelvis, or 5 cm from the hilum of the kidney. Don't forget, 5 cm from the hilum of the kidney is the what? Pelvic-ureteric junction. They are constricted there. The second one is where at the pelvic rim, where it passes through the bifurcation of the common iliac vessel, it is also constricted there. So the second constriction, the first one is the pelvic-ureteric junction, 5 cm from the hilum of the kidney. The second one is the what? The pelvic rim, where it crosses the common iliac vessel. The last one is the what? Uterovesical junction, where it enters into the what? The what? Bladder, the base of the bladder. You call it the intermolar what? Constriction. Don't forget. So next is the blood supply. The blood supply to the what? The ureter. The blood supply to the ureter. The ureter have so many blood supply because it is crossing so many blood supply. So every blood vessel that passes through the ureter supplies it. So don't forget this mnemonic: drumvit, 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 DRUMVIT. D for direct branch from the aorta, direct branch from the aorta. R from the renal vessel, R from the renal vessel. U from the uterine vessel, U for the uterine vessel. M for the medial rectal vessel, M for the medial rectal vessel. You have V, the vesicle branches, which is the superior and inferior vesicle vessel. And now you also have T, which is the testicular ovarian vessel, the testicular ovarian vessel. I, we skip the I is the internal iliac vessel. Don't forget it. Drumvit. D, direct branch. R, the renal vessel. U is the uterine vessel. M, the medial rectal vessel. V, the vesicular branches. And I, which is the internal iliac branches. T, testicular or ovarian vessel. All these branches passes through the ureter and also supply them. The ureter is what's controlled autonomically by the sympathetic and the parasympathetic segment. The sympathetic is derived from the spinal segment of T12 and L1 through the what? The renal, aortic, and what? The hypogastric plexus, while the parasympathetic is derived from S2 to S4 pelvic splanchnic nerve. The parasympathetic nerve is responsible for high increase in contraction and motility through the what? Ureter, while the sympathetic inhibits the motility of urine through the what? The ureter. So don't forget, it's controlled involuntarily autonomically by sympathetic and parasympathetic. Sympathetic through what? T12 and L1, renal, aortic, and hypogastric plexus, which what? Inhibits motility, while the parasympathetic increase contraction and motility through the pelvic splanchnic nerve S2 to what? S4. The lymphatic drainage of the ureter is very simple. Lymph are drained around the ureter through the what? The lateral aortic and the what? The iliac lymph node. The lateral aortic and the what? The iliac lymph nodes. Don't forget it. On the clinical relation or the clinical relevance of the ureter, always remember that the ureteric colic, which is the stones, can be trapped in any of the narrow, which is the pelvic ureteric junction, or where it crosses the pelvic rim, or where it enters the bladder. So kidney stones can be trapped in any of these places, or any foreign material can be trapped in any of these what? Constriction. So always remember, we call it the ureteric colic, which is the kidney stone, the stones that are passing through the ureter. The next one is that now the ureter can be damaged in any of these parts. It can be damaged in any of these parts. The first part, it can be damaged where it crosses the uterine artery during what is hysterectomy, which is the most dangerous part. It can be damaged when it enters through the bladder. It can be damaged at the ovarian fossa, and it can also be damaged when it crosses the what? Iliac vessel. Obstruction of these stones at any part of this constriction can refer pain cutaneously to our T12 and L2, and these pains can come from our loin to our groin, then shoot down to our scrotum or the labia majora. So first of all, you have upper ureter obstruction, which can refer to the lumbar region. We have the middle ureter obstruction, which can shoot to the genitals, which is our groin, and the last one is what? The pelvic splanchnic, which is the lower ureter obstruction, which shoot down to the perineum. So first of all, the narrowing can what? be at a part to what catch up what any stones, and when it catches any stones, these stones can refer pain to any of the cutaneous part of the skin from T12 to L2. I hope this all makes sense as we discuss the gross anatomy of the ureter, as it conveys urine from the renal pelvis of the kidney to the bladder for urination later. So hope we discuss the length, which is 25 centimeter. We discuss the part which is the abdominal and the pelvic part. We discuss the relation of different parts, which is the posterior relation, which is the psoas major and the bifurcation of the common iliac vessel, the different anterior relation, the blood supply, the nerve supply, and the lymphatic drainage. I hope you now understand. You go to your atlas and make sure you use this video to what understand more about the ureter. Now if you are new to my video, make sure to like, subscribe, and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. And if you have any questions, drop it down in the comment section, or you have issues understand any of the topics or any topics you are studying, put it also in the comment section. When I go to it, I will sure to make a video for you. So thank you and God bless you till we meet next again. Goodbye.